This is Dr. Stewart from Timonium Foot and Ankle Center, and I want to talk about diabetes and its impact on the feet and lower extremities. Diabetes is a very common condition that we see, and it's important for diabetics to learn and understand that they need to check their feet on a regular basis and they need to visit their podiatrist on a regular basis. Just because you have a diagnosis of diabetes does not mean that you're going to have problems with your feet. Just like anything in life, if you have a medical condition and you treat it properly, your chances of a better outcome are higher. And this can be the case with diabetes. We have plenty of diabetic patients that live a very normal, active lifestyle. They don't have complications with their feet. They're active. They're doing what they want to do. On the flip side, we have plenty of diabetic patients that don't do anything they're supposed to do, and they don't follow the rules, and they don't follow the directions, and they ignore their disease, and unfortunately, they have poor outcomes. And when I say poor outcomes, they can end up with losing their toes, their feet, their legs. They can have heart disease, heart attacks, strokes. They can end up on dialysis. So the bottom line is, just like any other health condition, you need to manage the condition. I have a lot of experience treating diabetes as it pertains to the feet and lower legs. I have a lot of experience in wound care. I used to work for several years in a very busy wound care center, and I did a lot of limb salvage. And I am happy to say that the majority of times we were able to save people's limbs. However, there were certainly times throughout the years working in the wound care center that we amputated a lot of limbs. And there is nothing worse than having to remove a body part from someone, whether it's just a small toe or a part of a foot or even more. We get much more satisfaction out of salvaging and saving a limb and educating people on their disease. So let's learn a little bit about diabetes and what exactly it is. Diabetes is a condition where blood glucose can become elevated. And to make it simple, there are two types of diabetes. There's type 1 diabetes, which frequently is referred to as juvenile diabetes, although it can occur a little later in life. Some people will get it in their 20s, 30s, but generally you'll see it in children. And this is where the body stops producing insulin. This is an autoimmune condition. Then there's type 2 diabetes, which is the much more common type of diabetes. And this is where over time, it's considered adult onset, although with the obesity, we are actually seeing it in, some children and even teenagers are developing it, and people in their 20s. But it's frequently thought of as adult onset diabetes, and over time, the body is not able to utilize the insulin properly, and it requires the use of medications to help control blood sugar. Insulin is a protein that binds to cells and helps put the sugar out of the bloodstream and into the cells. And when that process doesn't happen properly, it ultimately ends up causing elevated blood sugars, which can cause a slew of problems. Elevated blood sugars can cause nerve damage, which is why diabetics can develop something called neuropathy. And neuropathy is where you lose the ability to feel things. There are three components of your nervous system. There's the autonomic nervous system, which is where your feet will sweat. And if your autonomic nervous system is not functioning, that can really make the skin dry and more prone to cracking. There's the sensory nervous system, which allows you to feel things. So if I push real hard on my hand here, or if I were to take something sharp and poke it on my hand, I'd be able to feel that. Whereas someone who does not have sensation will step on something and not know it's there. And that's when patients can really get into trouble. Now, diabetes is the number one cause of neuropathy, but it can also happen in non-diabetics. Then you have the musculoskeletal neuropathy, which is what ultimately can end up with deformities in the feet. So the toes can start, this is an example of my finger, but a toe is very similar, where it will start to bend and then it can rub on the top of the foot, or the bones on the bottom of the foot can become very prominent and they can create calluses, which can ultimately result in wounds. And then diabetes, when it affects the blood vessels, it can cause clogging of the arteries. This can really be exacerbated by smoking. Smoking can really accelerate the process of what we call peripheral arterial disease or peripheral vascular disease, where the circulation to lower extremities is poor, and when there's poor circulation and the tissues aren't getting enough oxygen, ultimately the tissue can die, and that's the term gangrene is tissue death. And when gangrene sets in, unfortunately, that's when you have to start removing body parts and amputating toes and feet and legs, and that's the stuff we really like to avoid. So if you're a diabetic and you're concerned about your feet, there's good news. There's a lot of things you can do. There's a lot of good supporting documentation that shows the patients that visit their podiatrist and have their feet checked on a regular basis can have much better outcomes. And what will I do? What would I do when you come into the office for your feet to be checked? Well, what I would do is I would look at you, evaluate your feet, talk about your medical history, make sure your glucose is under good control. If it's not under good control, we want to know why it's not under good control. We want to make sure you're not smoking. We want to make sure you're exercising. We want to make sure you're checking your blood sugar regularly. This is not a condition that anyone wants to have. No medical condition is a condition that anyone wants to have. But there are really two options. You can either face it or ignore it. And if you ignore it, the outcomes are likely to be poor. And I've seen that firsthand. I've seen many people turn their back on their diabetes and their medical conditions, and they lose their legs and they get on dialysis, and unfortunately they don't survive long. And I've seen many patients who I still treat, and I see them every single day, and I probably have already seen 3 or 4 diabetics earlier today who are living normal, healthy lives, and they come in and they get their feet screened, and we reduce any calluses that are pressure spots that can create sores, and we get them in the right shoes, and we get them in the right orthotics, and we hydrate their skin, and if needed, we refer them to the vascular doctor to ensure that their circulation is in good shape, and we manage them. So when you come in, we will evaluate you, we'll check your circulation, we'll check your sensation, we'll make sure that your feet are not deformed to the point where they need some sort of intervention like an orthotic support, or if they need surgery. If feet are very badly deformed, we in fact will we try to avoid surgery, of course, it's never a first line of defense, but in certain circumstances, if diabetes gets real bad and the musculoskeletal component of the neuropathy takes over, feet can become deformed to the point where we need to reconstruct them and fuse the joints together and prevent these feet from becoming risk factors for wounds. And overall good hygiene, making sure that you're staying clean, you're changing your socks, you're avoiding barefoot walking. Barefoot walking is the worst thing you could do. I'll never forget when I was in residency, I had a patient that came in and he had a Coke bottle embedded in the bottom of his foot. And that patient followed me into private practice, and I was able to save a lot of his foot. I was able to save his leg. However, we ultimately had to amputate part of his foot because of this Coke bottle that was embedded in his foot, and he had no idea it was there because he had neuropathy and he walked barefoot, and he didn't notice the problem until his pet started to sniff around his foot. So the bottom line is we can share lots of horror stories, but the truth of the matter is there are many more diabetics that are doing very, very well. And the key is just to manage your glucose, which is not always so easy, but it's something that can be done. Work with your primary care physician or your endocrinologist. Make sure you're getting your feet checked. Make sure you're getting your eyes checked. Make sure you're following all the protocol for exercise, watching a healthy diet. And, if you have a problem, don't wait until it's too late to get help. There are multiple times where diabetic patients in my practice will call me and they're very worried and concerned, and we get them in and we take care of them and we look at them and we give them peace of mind most of the time. And there are certain times where we will have patients that waited a little too long, and those outcomes don't tend to be as favorable. So we educate people. The key is being educated. The more you're aware of what's going on with these conditions, the better off you will be. So if you'd like to learn more about diabetes and how it can affect your feet and lower legs, we'd be happy to take a look at you. Feel free to click on the form on this page and fill out a consultation request or give the office a call. Thank you.